Tina, I do not have the record button anymore. Meeting recordings in progress. Thank you. Good evening, everybody. Um, it's vaccination season, back to school shots. Welcome to the Baltimore County Department of Health monthly webinar series. Tonight, I'm very happy to introduce Dr. Isha Jain, who's going to walk us through the requirements and some references for what your kids need to go back to school as it relates to vaccinations. Dr. Jain.
Thank you, Della. So like she was saying, my name is Dr. Jen, and I am the Division Chief of School-Based Services at the Department of Health. And we're going to be talking about all things vaccines and what you need to be concerned about in this back-to-school season. All right, so for an overview of this presentation today, we're going to start with some background, get into why school-required vaccines matter, which vaccines are required in Maryland, and then some other additional recommended vaccines. And then finally, we'll finish up with talking about how to get vaccines at the Baltimore County Department of Health. So why are we doing this talk? Because we as the local health department in Baltimore County serve you, the community. We want to provide reliable information to help protect our community and make it clear that we don't have any financial conflicts of interest. This is just information that we're putting out there to help protect all of us. All right, and then just one thing to keep in mind is think about where you're getting some of your information. There's a lot of fake news, like disinformation out there online. And so it's always good to look at it if your information is coming from an evidence-based source. So that's going to be something like us, the local health department, or the state health department, Maryland Department of Health, or at the federal level, the CDC. And then there's certain professional organizations like the American Academy of Pediatrics that, are considered very trustworthy. Everything that these organizations put out is generally, well researched, and so that gives you backing for the information that they're sharing with you. And you always want to ask, where is this information coming from, and what's the evidence? So if somebody's out there just randomly saying things, it should make you think to not necessarily take it at face value. All right, so we're going to watch a short video about how vaccines work. Oh wait, hold on. I'm going to stop sharing because I think I forgot to share with sound. So I'm going to do that. Share computer audio. Okay. Sorry about that, but we will get back to this. Okay, so how vaccines for children and teens work.
When your child gets a vaccine, an amazing thing happens. Just like a teacher, the vaccine gives your child a lesson. The immune system gets to work right away, learning what to do if your child is exposed to harmful germs. All of us are exposed to germs every day. Some might cause a cold or a minor illness, but then there are more dangerous viruses and bacteria that can make children very sick. Diseases like measles, diphtheria, and polio used to sicken and kill thousands of children. That's why it's important to get vaccinated, so your immune system will know what to do. Here's how that works. Vaccines contain either an antigen, a piece of the germ, or some instructions that tell us how to make the antigen. They teach your immune system to produce antibodies to get rid of the virus or bacteria. Then those antibodies remember what to do if your child is exposed in the future. Vaccines can work in a few different ways. In some vaccines, the antigen is a virus that has been weakened. This means it will not be able to reproduce in your body to make you sick. But it does a great job of teaching your immune system to be ready for the real thing in the future. Other vaccines use a virus that has been killed, a tiny piece of a virus or bacteria, or a weakened form of a toxin, like the kind produced by the bacteria that cause diphtheria and tetanus. Same thing, it can't make you sick, but it teaches your immune system to recognize the germ. Getting one or more doses of a vaccine later on gives the immune system a memory boost so it remembers what to do. The recipe for most vaccines is pretty simple. Besides the antigen, some vaccines contain aluminum salts, which help make the antigen work better, so children can get a lower dose. The amount of aluminum in vaccines is small, much less than your child gets from everyday food and water. Some vaccines also include a preservative to keep germs out and tiny amounts of other ingredients, all very safe. After your child gets a vaccine, their arm may feel sore or they may get a fever. That's a sign your child's immune system is getting stronger. After the vaccine does its job, it leaves the body and is gone. A week or two later, your child's immune system is better able to protect your child. Remember, vaccines have been given to millions of children and teens. They are closely studied, and we know they are safe and effective. In fact, vaccines work so well, most reduce your child's risk of getting these diseases by 90% or more. It's an amazing way to protect your child so they can stay healthy and safe.
Right, so this video is from the American Academy of Pediatrics, and they actually have a community-facing website called healthychildren.org, which provides very reliable information about the health of your child and how you can help them stay healthy. So we learned a little bit about how vaccines work. And so now we're going to get into why school-related or school-required vaccines matter and why it's important for everyone who can to take part and get their vaccinations. All right, so there are basically, you can think about it, there's in the way that there's two, primary benefits from getting vaccines. It helps protect you and helps protect the community. So the person getting the vaccine, in this case, your child, they'll be protected from illness and complications from the illness. So in some cases, the vaccine doesn't 100% keep you from getting that particular virus or bacteria, but what they all definitely do is lower your risk of having serious complications, and we'll get into what some of those are later. And then in addition to helping yourself or the person getting the vaccine, when people get vaccines, it helps protect the whole community, because when there is a certain level of herd immunity or like percentage of people in the community that have a vaccine, the vaccine or the bug, whatever it is, if it's pneumonia or measles, it's not able to hop from one person to the other and like infect the whole community. It gets stopped in its tracks by the vaccinated person. And the other thing to think about is that there are some people, some very vulnerable people, like those who are getting chemo and have cancer or otherwise their immune system isn't working. They're not able to get certain vaccines, and they're actually more vulnerable because their immune system is not working. So they, in some ways, rely on the protection of the community for protecting themselves. All right, so we mentioned some complications. So what are these potential complications that we are protecting against when we get these required vaccinations? Now we're going to watch a short video.
As your child grows, continue protecting them. Vaccines help protect your child from diseases that cause blindness, brain damage, cancer, deafness, disability, encephalitis, heart damage, nervous system damage, permanent paralysis, pneumonia, and death. Between the ages of 4 and 18, protect your child from several diseases and cancers: tetanus, diphtheria, pertussis, polio, COVID-19, flu, measles, mumps, chickenpox, meningococcal, and HPV. Vaccines are safe and effective for children. Schedules are designed for your child's growing immune system. Give your child the lifetime protection they deserve. Let vaccines prevent what's preventable. Contact your provider today.
So this video is from immunize.org, which is a nonprofit that provides vaccine information. And I just wanted to give an example about the way that things used to be before mass vaccination and before some of these vaccines were even, invented. So one of the complications that was mentioned in that short video was paralysis. So that was mostly due to the illness polio. And polio, what you can see here is the reported polio cases and deaths in the US from 1910 all the way to 2022. The blue line here shows the number of cases and the red shows the number of deaths. So we can see that the number of cases of polio really fluctuated and was sometimes very, very high, up to almost 60,000. But then when the first vaccine was introduced, we can see that the rate really decreased, the number of cases really decreased. And then there was another type of vaccine introduced, the oral vaccine. And then since then, we can see that the number of deaths and cases has been very minimal. And polio is a disease that's considered eradicated in some parts of the world because of effective vaccination. And there's actually an estimate that since these vaccines were first introduced, the polio vaccine has prevented almost 30 million cases of paralysis worldwide. So that is a lot of children that have been saved from having a potential complication from a disease. All right, so that's why these vaccines are important. But now let's get into which vaccines are required by law in the state of Maryland. All right, so Maryland does require many vaccines. The recommendations follow the CDC recommendations closely, but the required vaccines do not include all the recommended vaccines from the CDC. They kind of have a couple that they leave off, and we'll get to those. But it follows the recommendations very closely. And there's a link to the required vaccine schedule from the Maryland Department of Health as well here. And you can think about it as there's kind of two batches of shots that are required for entry into school in the state of Maryland. There's the 4 to 6 year group of shots, and then the 11 to 12 year group of shots. And we will look at those kind of more in terms of the grade level instead of the age, because it's really the grade level that we end up looking at. Okay, so on the younger side, we have the preschool vaccines. So a lot of these are vaccines that a child would be getting as they're much younger. They'll be getting, diphtheria, tetanus, and pertussis, or DTaP, polio, Haemophilus influenza type B, MMR, which is for measles, mumps, and rubella, varicella, which is chickenpox, hepatitis B, and the pneumonia vaccine as well. So the ones that you typically end up having to get right before enrolling in preschool, or closer to enrolling in preschool, would be the MMR and the varicella. And then in kindergarten, when you're enrolling in kindergarten, you're supposed to have all of those preschool vaccines in addition to a second dose of the MMR and the varicella. And that is a booster to help the immune system have longer term immunity, so it lasts, longer in the lifetime. I put an asterisk here next to the pre-K vaccines because there's a couple of vaccines that if you are unvaccinated, say, for hopefully nobody is completely unvaccinated, but if you are unvaccinated and you need to catch up, if you're enrolling your child in kindergarten, there are some vaccines that you wouldn't be getting that otherwise they would have gotten at the preschool age, because they've basically passed the window for that disease potentially being harmful for them. So, but also what that means is that when they were younger, they were vulnerable for that disease. So again, it's very important to follow the recommended schedule and guidelines. All right, so then we have our 7th grade vaccines, which is just 2 of them, a booster for the tetanus, diphtheria, and pertussis vaccine, and the first dose of the meningococcal vaccine, which is for meningitis, bacterial meningitis. All right, and I did want to say that if you are somebody who has been, hesitant about vaccines, but then you're kind of changing your mind, wanting to catch up on vaccines, you can catch up on all of the required vaccines in less than a year, even the ones that require multiple doses, because you can get multiple vaccines all at the same time. And so it's always good to get the vaccines, even if you're getting them later in life. Or when your child is a little bit older. They are required, again, for the ones that we mentioned are required for the state of Maryland. But it's always a good idea to get vaccinated and stay up to date. Right. So I did mention that there are some vaccines that are not required in Maryland. So these would be the recommended ones that there's a lot of evidence for, that the CDC and healthcare or professional organizations all highly recommend, because they prevent against severe illness, but it's not something that the state says is required, and it's not something that your child will be kept out of school for. So the not required vaccines here are, there's 3 of them listed here. We have the 2nd dose of the meningococcal vaccine, and what you're protecting against there is meningitis and death. The HPV vaccine, or it's the human papillomavirus vaccine, that is one that's multiple doses, and it is a vaccine for many different types of cancer and also for genital warts. And then finally, we have the illness hepatitis A, which is one that some people might get as a travel vaccine, but it's also just generally recommended because this illness can cause liver failure and also potentially death. All right, so those are the ones that are kind of the one and done, or finishing that series, then you're done. But then there's other vaccines that are seasonal, and so these are ones that we generally recommend that you get every year. So for the flu, for older kids, the number of doses is just 1 dose per season, and that is something that we are going to be offering soon once it's available. It's not quite available yet, but what you're preventing and protecting against there is pneumonia and death. So this is one of those where the flu vaccine is not 100% in terms of keeping you from getting the flu altogether, but it definitely decreases your chances of having to be hospitalized because your lungs stop working, or having the risk of death. And so you might be thinking, the flu is something that you just have to deal with. It's not that serious. The risk to children is, pretty low. Well, that's true. But in this case, healthy children, and this is a recommendation from the American Academy of Pediatrics and the CDC, it is recommended that children get these vaccines every year, the flu vaccine, because it benefits them. It decreases their risk of getting a serious complication, but it also helps protect people around them who might be vulnerable. And it's one of those that, again, it's not required, but it's highly recommended, because it helps, protect the whole community. Now, looking at the COVID vaccine, this is one that's a little bit different because the recommendations differ between the American Academy of Pediatrics and the CDC. It's perfectly valid for the recommendations to differ. Different professional organizations have different opinions. In this case, the American Academy of Pediatrics says that for children less than 2 who have never been vaccinated for COVID, because they were just born not too long ago, it is highly, highly recommended. And they say for all children less than 2 years old, you should get the COVID vaccine, because it helps give you initial immunity and protection for COVID, and helps prevent very serious outcomes. For older children, for older otherwise healthy children, I'll be specific. The CDC says that it's more of a shared decision making, or like a conversation you can have with your provider or your child's doctor. Whereas the American Academy of Pediatrics does say that it is more, a little bit more of a stronger recommendation. But they do say, in this case, and really in the case of any of these not required vaccines, it's always good to ask questions of your provider, talk about the risks and benefits, and consider what level of risk you're willing to take on in terms of not getting vaccinated, right? I will say in most cases, getting vaccinated would definitely be the better bet. All right. So if you don't know what vaccines your child needs, you're not alone. A lot of people can't just state that off the top of their head. So if you have a regular provider or like a primary care person that your child sees, then it's always good to start there and see what they need. If they're enrolled in a public school, then the school will definitely tell you which shots your child is missing, and what is required for them to stay in school past the exclusion deadline. And then you can always request your record from the Maryland Immunization Tracking System, or Immunet, if you have gotten your child's vaccines in the state of Maryland. If it's been elsewhere, then you would want to request from that entity. Then the other thing you can do is come to the health department, and we will be able to help you out and help you figure out which vaccines you need to make sure your child is able to stay in school. All right, so I just touched on this, but where can you get vaccinated? Definitely, if you have your own pediatrician or provider, you can always go there. But if you do not have that option, or you're not able to get in, you can always come in to one of the health department locations. So we have a big push and big focus on back to school vaccines. So for the public school students in Baltimore County, they will be excluded from school and on Monday, September 15th, if they have not received their required vaccines by that time. So we have many opportunities for people in the community to come to us to get these vaccines. So the first thing is that we have extended hours, and also more appointments for vaccines at our existing health centers, and we'll go over where they are all located. And I did want to mention, for those of you watching the recording, these dates are accurate as of fall 2025. So if you're watching it later, the dates are not going to be correct, but the information generally will be correct. And if you have questions about when the extended hours are, and when you can specifically come in to get your shots, you can always call these phone numbers, because those are going to be the same. So our health centers will have walk-in appointments, but we'll accept walk-ins, but appointments are preferred. And you can call to schedule an appointment. One thing to keep in mind with our clinics is that it's a sliding scale, meaning you pay what you can. So we accept people with insurance, with Medicaid, without insurance, all kinds of people. We do not verify your income. It's unlike some, safety net clinics where they ask you to bring like pay stubs and stuff like that. We don't do that. It's much less of a hassle. And we do not check other things like your immigration status or anything like that. We welcome all clients to come to the Baltimore County Health Centers. Right, so I'm just going to hold on this slide for a second so you can see the different locations that we have for the health centers. They are located all throughout the county on the east side, west side, in the middle. So you have these four here are Woodlawn, Eastern Family Resource Center, Dundalk Health Center, and Baltimore Highlands / Lansdowne. And the regular schedule is 8:30 to 4:30 with a closure for lunch at 12 to 1. Those are the regular hours. And we also have at the same schedule, we have Essex, Hannahmore, and Liberty Family Resource Center. I'm going to stay on this slide for a second. You can always pause the video to note down any phone number that you might need to note down. Okay, so in addition to those regular hours, there are some extended hour times where if you are not able to go in from 8:30 to 4:30 due to work or whatever it may be, clinic is open a little bit later. Again, these dates are not going to be accurate past fall 2025, but if you need to have your family taken to a after regular hours clinic, then you can always call one of the health centers and find out what days that's going to happen for whichever year you're watching this video. So we do have this year in fall 2025, we have evening and weekend back to school clinics at Eastern Family Resource Center on September 4th, and then Woodlawn Health Center on September 9th. And then we have some other, like, if you really are not able to get in, before the deadline, like, or, well before the deadline, which is what we recommend. Don't wait until the last minute, but you do have a last chance to do the September 13th Saturday clinic, which is the Saturday before the Monday, which is the day of exclusion. And then we also have a Thursday clinic, which is happening after the exclusion. So this would be for people who were not able to make it before the deadline. So you can get your vaccines and then get back to school. All right, so I have linked some sources here from the American Academy of Pediatrics. There's more information about each vaccine preventable disease. So all of the different diseases we talked about, such as measles, varicella, meningococcal disease, all of those, you can find additional information about each one of those diseases and also the vaccines for them. And then there's a page with myths and facts about vaccines. All right, so now I'm going to open it up to any questions. I'm going to stop sharing my screen. And I'm back here.
Okay, we have a question in the chat. What can a parent do to alleviate their child's fear of getting shots?
Okay, that is a great question. So this is something that any provider you're going to get your child's shots, whether it's with us or your pediatrician, we're very well familiar with kids, hesitation, fear around needles and shots. And so this is something that, you can be coached through in the moment. It's always helpful to remind the child that, like, it's going to take just a second, and you'd be surprised. The kids will usually, be very scared in anticipation, but then once it's done, they're like, oh wait, that's it? Like, it was so quick. And then the people actually giving the shots are very experienced and make sure that it's done very, very quickly. And then in terms of, further helping to placate them, most offices or places will offer like a sticker or something like that for getting that done. And I will say the best thing that a parent or a guardian can do in this whole process is just to hold their child, reassure them, and maybe help distract them so that they're not so singularly focused on, oh my gosh, what's happening with my arm or leg. So it's definitely something that we're very familiar with and can help guide a family through. Okay.
All right, next question in the chat. Does the health department see children who have Medicaid, and how about children with no insurance?
Yes, so we are able to see children who have Medicaid and also children who have no insurance. So this is, we participate in a program called Vaccines for Children, which is where we are able to give vaccines free of cost to any person who is on Medicaid or has no insurance. And so if you come in, we are able to figure out which vaccines you're due for. We can provide those vaccines at no cost to you. Okay, and the next question in the chat I see, sorry, Della, you can read it.
Not good. Can it harm my child to get several vaccines at once?
So I can see how it might seem scary to have multiple needles, pokes at the same time. I will say that it is very safe. There's very few cases where you cannot get two vaccines together. All of the required vaccines are ones that you can get, overlapping, and the vaccine schedule is such that, in order to make it so you're not having to come in like every month or every other month to get shots, they're all like clustered together. So you're able to get like 4 or 5 things done at once, and then you're good for a while. And that is something, this is the way the vaccine schedules have been for many years. This is very well studied. It's definitely very safe. And in fact, the number of, or like the number of antigens, or like the size of the volume that's going into your child's arm overall has decreased over time. So even though in theory it sounds like, my kid's getting so many vaccines all at once, they're getting less stuff, if you will, than they would have been getting like 30 years ago. And the other thing to keep in mind is that we do have many combination shots as well. So there are ones that combine like 3 or 4, sometimes 5 different diseases for the vaccine. So it minimizes the number of pokes that your child needs to get. And you get all the benefits without any, risk with getting all those vaccines at once.
Thank you. How do my vaccine records get to the school after my child receives vaccinations with the health department?
Hey, that is a great question. So I mentioned this earlier. There is this program called Immunet. So if you get your vaccines in the state of Maryland, which, as the Baltimore County Health Department, we are located in the state of Maryland. If you get your vaccines, those are mandated to be reported to the Immunet system. So then your child's school will then pull a report from that system and know that your child did get the vaccines that they needed. So you don't have to take anything to the school or call them or anything. You just have to, you can tell them to check and see that your child did get the vaccines, which they will independently be able to verify without any further intervention from you.
Thank you, Dr. Jane. I do not see any more questions in the chat. If there are any, you can unmute yourself. If not, we thank you for joining us tonight on the Baltimore County Department of Health monthly webinar series on its vaccination season. Back to school starts. Everyone have a good night. Thank you, Dr. Jen and participants.
Thank you.